You are listening to Live Free with Rebecca Packard. With this podcast, Rebecca will help spiritual entrepreneurs and mompreneurs experience emotional freedom so that they can create calm and balance in all areas of their life. If you're ready to release your emotional baggage, trauma, and that constant feeling of overwhelm, then you are in the right place. Your journey starts now. Here's your host, Rebecca Packard.
Welcome back. It is Rebecca Packard, and I am so excited. You guys, today we have a special guest. We have Dave Shirazi here, and we cannot be more pleased because he has a very extensive background in a lot of different things. He's quite knowledgeable in a lot of fronts. He has a practice in the space of a dental practice, but he's also been someone who taps into that space of your intuition and the knowledge behind that space too. He is in the process of writing a book and in the process of visiting a lot of podcasts at this moment to share a very important topic about TMJ, which we are going to talk about, and how that shows up in your life and how it affects you more than just in the space of a sore jaw, because a lot of people don't give that dental world that space of their mouth, which is amazing because one, you see it every day. Two, you brush it twice a day. And three, you're using your mouth constantly, you guys. Let's take a little bit more time to give it the necessary love and care and attention that it needs. Also, the space of self-expression, like, oh my gosh. So Dave, hi, welcome. We're excited to have you here.
Thank you. I'm excited to be here. I love working with you. And now we get to do a podcast together. That's so exciting.
I know, right? And I would love for you to just take a minute and introduce yourself, because I know you and love you and have been sharing time with you. And I know that other people may not know you quite as well as I do. So let's just take a second, introduce yourself, give a little background, and let them know you a little bit more.
Well, I don't know where you want to start. So I am a dentist. I'm an acupuncturist. For 5 years, I was a sleep technologist. I have a master's in spiritual psychology, and my practice is limited to helping those with, as you said, TMJ and related pain in the head and neck region, snoring and sleep apnea, and we do something called functional orthodontics in children and adults.
Yeah. Fantastic. And now I know a lot of people are going, spiritual masters, right? Wait a second, but you're a dentist. But these two things are so closely related in that there's so much energy connected in that space. So I'm sure people are going, well, tell us how this works. What are you doing for people behind the scenes in the space of, so they come to you for dental work, and how does your master's fit into that?
So just so you know, I don't do traditional dentistry. I just focus on pain and sleep and orthodontics. And well, goodness, the psychological aspect. Well, if you're in chronic pain, if you have a trauma, PTSD, if you're not sleeping well for whatever reason, that's going to have a profound effect on our psyche. That's just how it is. And I'd like to give people tools. If they choose to use it, great. If they don't, they don't. I'm not a therapist, so I don't want to engage in regular therapy, but I want to give people tools that a lot of them have never been given before. I was never given before, so I had to kind of learn them on my own. A common one that I use a lot is I'll tell my patients and my staff, and I'll remind myself of this when I'm going through a challenging time, is that nothing has a built-in meaning whatsoever, meaning everything is neutral until we decide it's good or bad, right? And I give examples, like I'll say, okay, well, in Hong Kong, it's considered polite to burp at the dinner table. Right? It means you ate the food so fast, you inhaled it and you got air in your stomach and you had to burp. And it's such a well-known thing that kids will fake burp at dinner to let the mom know how delicious it was, right? Now, in the West, we consider burping at the dinner table rude and disgusting, right? So if we take the meta position, we can look back and go, so burping at the dinner table doesn't carry an intrinsic meaning because it's a really big positive in one demographic and it's a really big negative in another demographic, right? That means it must be neutral, right?
Mhm.
And then if we start looking at everyone on the planet, we can say there's roughly 2 billion people that believe that eating pork and shrimp is dirty and sinful, right? Right next to the 2 billion, there's 1 billion that say, well, pork and shrimp is fine, but you can't eat cows, right? And then there's roughly 3.5 billion that say, well, you can eat whatever you want, just not on certain days of the year, right? And then there's between 0.5 and 1 billion people that say, well, you shouldn't eat any animal, right? So again, if we sit back and take the meta position, we can conclude that eating or not eating any animal, any day of the year doesn't carry a built-in meaning, other than you could say most of the time we're killing it, right? Buddha actually did eat meat, but he just didn't want any like killing associated with it, right? So if we look at that situation, we can say, goodness, for centuries, people have gone to wars over their religious beliefs, right? But it's, it's so variable, right? Like Ricky Gervais has this, he's a very, he's a funny comedian, but he's also a very proud atheist, right? And one of the things he says often is that there's 3,000 religions in the world, right? And when you're one religion, you're not only saying you believe in this God, you're also saying, I do not believe in these 2,999 gods. So there has to be a bit of humility when we look at that and go, okay, well, maybe my thing is not as true as I think it and want it to be, right? And there's opportunity to change that.
Yeah, it's so important that so often people just get in that space of reaction. This is a moment, this is something I have to react to, and taking that breath and saying to yourself, I am neutral in this space, bearing to be the witness, right? Choosing to be the witness in the moment and say, oh, this can be neutral. How do I really feel first? I love that. I love that you are showing up in the space of giving people the tools and practices outside of what it is outlined as your this is what you do in the dentist world that you live in, of giving them and seeing that trauma and different experiences and abuses and different things that happen throughout life all affect all aspects of us. It affects your teeth, it affects your jaw, it affects your brain, it affects your muscles, it affects your whole being. And just being a doctor in a space of, I'm sure there are more and more that are tuning into your station, but you are someone who's actually in the space of a trendsetter per se, because you do recognize those things and you do acknowledge the space of, you're experiencing this chronic pain, you're experiencing this TMJ, you're experiencing not sleeping well. Let's look at the bigger picture and not just, here's the tiny box, let's check it off. It's so important.
And I stand, with full humility, I will tell you that I stand on the shoulders of my mentors. I get to do what I get to do and teach to people who want to learn this more holistic approach by learning and standing on the shoulders of my mentors, who have been great. Dr. Derek Nordstrom, Dr. Steve Olmos, Isabel Benarus, people that have brought me to such high levels, even Laura Powers, who we both work with. I've learned so much.
Yeah, it's so awesome. So in the world of pain in the jaw, share more about that, because there's a lot of people who don't even realize that they're experiencing symptoms of TMJ, and they're experiencing they're like, well, I'm not sleeping well, and I wake up and my face hurts, but it just, I don't know what's going on. Like they just are so
because
oblivious.
we're technical, two reasons. One, we're technically unconscious when we're clenching our teeth, and we cannot clench our teeth during the day for a full second with the intensity that we clench our teeth at night. It's so painful. but our brain shuts it off and lets us do it. There's another aspect to the jaw that's very interesting. So if you have, let's say, chronic lower back pain, you'll make a point of trying to sit down and lay down as much as possible and not getting up, not exerting your back too much, right? When it comes to your jaw, you don't ever get a break, right? You chew, you talk, you clench your teeth, and then we swallow 2,000 to 3,000 times a day, 2,000 to 3,000 times every day. And every time we do, our teeth come together and our jaw goes into this furthest most up position, which is where we don't want it to go for most people. The issue is we have a mechanism in our brain, in the prefrontal cortex, where it doesn't like redundant information. So for example, we all know if we walk into a room that smells bad, after about 5 minutes, we don't smell it anymore. Right? And then not even 1 minute, we don't smell it anymore, right? And because it's useless information and it could get in the way of making a decision that could help in survival. So with the jaw, we swallow 2,000 to 3,000 times a day. If you have a jaw problem, your brain cannot be burdened with 2,000 to 3,000 messages a day of ow, 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 ow. Now, other parts of your body. So we know that people who clench their teeth at night are very susceptible to having what's called tension type headaches. And we'll see a resolution or a great improvement of tension type headaches by treating the clenching at night. We see the same thing for migraines to a lesser extent. We see it with facial pain. We see it with ear pain and tinnitus. We see that. But people who have headaches, migraines, facial pain, ear congestion, things like that, they kind of focus on that symptom and don't make the connection with the jaw. Right? Now, I've met neurologists, I've met ENTs that are switched on and know the connection exists. And if they can't find anything else, they'll say, hey, you should see, someone who specializes in TMJ therapy. But it's not common at all. It's not common at all.
Yeah, it's one of those things where it's like, a lot of people go, well, what came first, the chicken or the egg? And most of the time it's the clenching. And very often they're like, no, but I have an ear infection, or no, I have allergies and it's giving me this ear pain. And it's like, nope, you're clenching your jaw all night.
Yeah, so, that's right.
What are some things that people can say, okay, this is what I should be looking for to see if I should be looking into, is this an occurrence for me? So what are some of your key things?
Well, I mean, the basic one would be, do you wake up with sore jaw? Did your dentist recommend a night guard? Things like that. But just having tension type and migraine type headache, facial pain, just those symptoms alone are enough. If you're fracturing dental work, if you're fracturing your own teeth, it's kind of comical. So for my practice, I would advertise in the local, what's it called? Dental Society, in their quarterly newsletter. And one of the things that dentists do, I'm sure physicians do it too, if we see an x-ray, if we're just like reading a dental magazine, if we see an x-ray, we right away start diagnosing. Like we can't help it. It says it's what we do. Not even our patient. We're not even going to read the article, but we just can't help it. Right. And it's actually, I thought I'm just going to do this. I put a picture of a very typical Panorex, right, that people see in their office every single day on a third of their patients. And you'll see like the molars are like root canaled, crowned, and, you'll see like arthritis in the jaw joint. You'll see, this gonial deposition here on the corners from clenching. And I circled it. Like I circled all these things. It's like, you notice that the front teeth didn't need all these crowns, but the back teeth needed all these crowns, right? And it is true that your first molars came out at 6, but your incisors didn't come much longer after that. It was like months, a year later. So that's not why. So because that's the conventional wisdom is, well, the reason why the molars get all the abuse is because they're the first adult teeth in, right? And it's like, well, okay, sure they are. And yes, we do chew with them. So that does factor, but we're not talking cavities, we're talking fractures, right? And root canals. And then I've, circled the arthritis in the jaw. And I just kind of like look at the dentist like, guys, this is what's going on. And now we have research that shows that roughly 50% of the time when we clench our teeth at night, it's due to some form of sleep apnea called upper airway resistant syndrome. And the other 50% of the time we say stress, but the stress could be induced by, emotional stress. It could be eating foods that you're intolerant to. Just we see it all the time. Yeah. So that's why, even though here we're talking about more holistic, more organic origins of someone clenching their teeth, I still recommend, if they're wearing a correct appliance to control their clenching, I still recommend that, because there's so many reasons that we clench our teeth. We can't get to all of them in a limited amount of time. Like, I mean, if you're driving on the freeway and someone cuts you off, you're going to clench your teeth. If your kids or your spouse bothers you, then you're going to clench your teeth that night, and if you're gluten and dairy intolerant and you have a slice of pizza, you're going to clench your teeth that night. So you kind of need it. You kind of need it. Those that do and have a problem, they need it, and they need it for life, because we can't promise that you're not going to clench.
Right. And it's better to safeguard and take care of the teeth than to damage them and to continue
and your quality of life goes up.
Yeah.
Not just preventative, because you're spot on with being preventative, but also it really improves your quality of life. And if I suspect it, I'll refer my patients to go get a sleep study to see if their sleep study is causing their TMJ problem. And oftentimes it'll come up. And one, that's great, because we're treating both problems at the same time, hopefully, and we're helping them get a better sleep. But now we're helping them get a good night's sleep, which has a global effect on literally every aspect of their life, be it physical, be it mental or emotional, everything.
Yeah. Sleep is essential to living.
Absolutely. More than diet and exercise, believe it or not.
Yeah, absolutely. And so many people right now are choosing, well, I'm just going to powerhouse through the night, or I'm just going to cut back on my sleep. And sleep is like breathing. You have, the more the better, right? The more the better.
That's right.
In the space of showing up and having people be preventative, having people utilize these different things that you are suggesting, like a guard or something like that. What are some things that help people in the space of getting a good night's sleep if they do have this problem? Outside of that, are there things that you recommend?
So you mean in the absence of making a TMJ appliance or a sleep apnea appliance? But I just want to answer your question. Okay. So believe it or not, one of the most important things is being able to breathe through your nose, right? One of the things, I hope you're not offended. One of the things I've been noticing in doing our chats is like we call it the nasal valve. The opening into your nose is like, for you, is like really small. Right. So we recommend, I make my own nasal spray with essential oils that helps open up the nose. There is something that you can buy online called a mute nasal dilator that it's like an O-ring, goes inside the nose so you can keep it open. It's really great. It's really, really great. Awesome. That's a huge thing. Nasal patency is incredibly important for both TMJ disorders and sleep apnea. Having the mental tools to calm yourself down in a stressful situation will pay dividends later, right? That's a huge thing. Making your sleep environment safe and sacred. So we want it dark. We want to be away from electromagnetic noise. So if you can be away from an electrical outlet, that's great. If you can, I don't have a TV. I haven't had a TV in my master bedroom for, I don't even know how long. My wife keeps pushing for it, right? And I keep telling her no. And she's one of those people that can sleep with the TV on. I am, oh my God, I am not one of those
Not
people.
the person. Yeah.
And she wants to say that she's like, oh no, I can turn it. I'm like, no, you can't. Right. And it will ruin your sleep. Having it cool, slightly cool is important, like 65 degrees, 70 degrees is important. Make sure you only reserve your bed and the space that you sleep in for sleep and sex only. So you don't eat, you don't have arguments, you don't have family meetings. You just, that's what it's for. That's it. If you need to do work on your laptop or whatever, walk into another space and do it. I don't care if it's the kitchen. Just walk into another space and keep that area sacred. If you live up in the mountains where it's very dry, you may need to add a humidifier so that your nose doesn't dry up. Because what we do instinctively is if our nose dries up or the tissue swells up, we switch to mouth breathing, which then has a cascade of other problems, a huge cascade.
Those are great tips. Those are great tips. And I think that it's super important. Two really super important ones. Like they're all important, but the two top ones, no TV and only have sex and sleep in your bedroom. I have not had a TV in my bedroom ever. Except for when I was in college and there was only one room living in the dormitories. And it was funny when my husband and I got married, he's like, we're going to have a TV in our bedroom. And I said, oh, no, we're not.
That's right.
That's not happening. And even 10 years later, we still don't have a TV. And now he's like, yes, no, we will never have a TV in our bedroom because now he gets it. And then the space of only doing work in workspaces. Especially, you guys, this is so imperative now that people are working at home, keeping the separation of workspace and relaxation space, of sacred space and of function space. It is important to allow your psyche, your brain to switch between those spaces because it helps you to come into the space of relaxation. It helps to create those boundaries of I'm in go mode, I'm in relaxation mode. It will help you, and it will, like Dave said, it will pay dividends if you do these things. And when you get a good night's sleep. So if you are not sleeping well, try some of these things. Try lowering the temperature. So many people sleep in a hot bedroom. And again, we're talking about drying out. When you're in a hot bedroom, whatever area you're in, mountains, desert, wherever, if you're in a hot bedroom, you're drying out. So lower the temperature. Make sure, I'm always amazed, and I'm sure you are too, Dave, at the space of people will skimp and chintz and do the least amount of anything with their bed, with their pillows, with their sheets, and you spend the most amount of time in this space. Like you're
a third of your life,
huge
portion of your life, a third of it. I couldn't agree with you more.
Yes.
Getting organic tissues, getting pillows that are not overly firm, that are not filled with allergens like down. Those are really important. I wholeheartedly agree. And I think it's something worthwhile to make an investment in.
Yeah, absolutely. Like, and if you are looking going, oh my gosh, well, this mattress is so expensive or that's so expensive, start yourself a little fund on the side, a give back to you fund, because if you are sleeping well, you are a happy person. If you are sleeping well, you are a healthy person. If you are
Very
sleeping
true.
well, you are like going to be living your best life. And
so true.
so,
Dave, I say take it from the Starbucks money. Like,
yeah, exactly.
I don't know if people understand. $4, $5, $6 for a cup of coffee is outrageous.
Right.
It's amazing.
1 month and you could have a new bed.
Yeah. And a lot of these bed places will do financing, which it works out to your Starbucks habit money. Right.
Yeah,
and
absolutely.
It's unbelievable. Like when I look at it, I'm like $5. Like, my wife has got the addiction. So I'll go ahead and I'll pick her up an iced mocha with whipped cream for her from time to time. It's like $5.25. I can't stand it. $5.25. I bring it to her, and it makes her happy. So it's a gift of love,
Right.
but at the same time, I'm like, it's $15-$20 a week.
When most people go in and they get what they get, the average, they say across the board, the average cost when you walk through and you go into that green space of coffee, in the space of Starbucks, is a $7 median is the space that people
Wow.
usually spend.
'Cause-
So you're looking at $49 a week. That's $196 a month. That is a new mattress on finance, you guys.
But a short finance at 196.
Yeah, you
Yeah,
be
I
done
agree.
paying for that fast.
Yep.
So, and you won't have to go work out as often because your
Mhm.
calories will be cut too, right?
That's right.
So many positives. But so in the space of those things, how are you taking care of you? Because in the space of dentistry, we know that whether you are a formal dentist or you are a holistic dentist or you are somebody who works in a focused sector, which you are a very focused sector, dentists have the highest suicide rates,
One of
even
the
today.
highest. One of the highest.
Top five.
Yeah.
Globally in the space of practices. So how are you showing up for you and taking care of yourself? Because to show up for other people and to show up in the way that you show up, you have to be taking care of yourself every day, right? So how
Yeah.
are you doing that for you?
Well, first, let's speak to the context of why should dentists even feel that. So the majority of dentists, they're drilling and filling the majority of the time. And, we have to be exact to 1/10 of a millimeter in a wet environment with a tongue and a cheek fighting you, while the patient is wide awake and looking at you, like you're really literally in their face. Okay. And sometimes they're giving you up to the second feedback. Right. And then I can tell you with impunity that there is no training in how to run a practice when you get out of dental school. There is no business experience, no how do you manage staff experience. There is nothing. I recall the only thing they told me about how to be more profitable as a dentist in dental school. And to this day, I would consider it one of the worst pieces of advice I was ever given. So that's one thing. That's stressing all those things. A lot of dentists don't have the interpersonal skills to help people, like tell them no, that's we have boundaries for that. You can't do that. No, you guys got to, if you're going to work together, you have to get along. That sort of, we don't have those skills, the majority of us, I fully admit. And in Chinese medicine, we consider mercury a depressive. Right? We put mercury, I don't do it, but the Chinese put mercury in their cough suppression herbal formulas that you take for a week because it brings your qi down, we say, right? Now, as a dentist, if you're drilling out old amalgam fillings and then putting new white ones or whatever, a lot of them are inhaling that stuff.
Right.
Right. I once went in to get chelation. I got an IV. I'm not a fainter, just so you know. I don't faint, like sight of blood, nothing. I wanted to be a surgeon. I'm not afraid of this stuff. But my naturopath, who's one of my best friends, he gave me a shot of something unbelievably safe. Like you can give it to newborns. It's so safe. But it chelates you, right? It pulls the metals out. He gave it to me. I fainted, right? God knows what I had in me. So and when I had my blood levels checked last year, they were over the top, right?
Wow.
They were, like, for example, it's what's normal was 0 to 0.8. I forget the units. Mine was at 7.0.
Oh, wow.
Which is a hugely high. So I have to consciously avoid fish, and I went through, God knows, over a year of bi-monthly chelation. Yeah. So does that answer your question? I'm sorry, did I get to everything?
Yeah. In the space so what are you doing for yourself?
Right.
So you do the chelation. What other regular practices are you using for your own mental wherewithal, your own mental health and stability on a day-to-day basis?
Yeah. So for someone who's got a pain practice, even though we don't have to deal with the nuances of having to be 1/10 of a millimeter accurate in a wet environment to that extent of the regular dentist, we have to deal, unfortunately, on a regular basis of people who are not in a happy place. Right. And sometimes it's really interesting. As someone's pain is breaking, they get happier. And sometimes a newer patient will be angry at an older patient in the lobby who is so happy. They're actually bothered by this. They're actually bothered by this. So one, I acknowledge the fact that I'm in a very sacred position where I could potentially help someone both physically and mentally. And two, I mean, meditation is huge, right? As I tell my staff, I tell myself to not take what patients give you personally. It has more to do with them than it does with you. And we have boundaries. If they ever treated you, I'll fire the patient. We have boundaries, and you are an extension of me, and they're not allowed to speak to you a certain way. So if they can't respect that boundary, they're out. But I mean, meditation, to me, meditation is an extension of sleep. Right?
Yeah.
Sometimes we can recoup the losses of sleep from meditation, depending on what you do.
Yeah, absolutely. Absolutely. Like if you've had an awful night's sleep and you know it, or if you just are finding yourself in a space of prolonged exhaustion, a 5-minute meditation, a 10-minute meditation during the day. Because some people say, oh, well, I can't sit down and do 45 minutes. And you know what? If
You
you're
don't
new
need
to it,
45 minutes.
you don't need 45 minutes. 5 to 10 minutes is more than enough. And oh my gosh, there's so many free meditations on YouTube. Just slap on a headset and give yourself a power nap. You can power nap yourself back to sanity.
Right, exactly. It's so true. It's so true.
Absolutely.
It is true. So, I mean, I'll do acupuncture for my staff if they request it. I don't charge them, obviously. And they'll just like lay down. We have a lot of tools. We use a technique called alpha stim. So they'll kind of get that little spot treatment for themselves, essentially, when they if they feel like they're a bit overwhelmed.
That's
and
amazing.
I'm very big on supplements to help people get the nourishment they need, and brain nourishment is a real thing,
Huge.
So I mean, those are the things that I'm doing. And we'll sometimes have uncomfortable conversations where I'll say, okay, well, this might be related to something that happened outside of the office. And everyone must always take personal responsibility for their own upset, right? There is, which is not to say that there is, it doesn't exist what you want and what you don't want. That exists. Okay. Just like when we talked about in the beginning about how everything is a neutral event until we decide to make it good or bad. That doesn't take away from the fact that we want some things and we don't want some things, right? So taking personal responsibility is really huge. Taking personal responsibility is really huge. I had an amazing experience. So when I did that master's program in spiritual psychology, we talked a lot, probably the whole 2 years, about how external manifestation is a result of internal dialogue and internal homeostasis, right? In consciousness, right? That everything, your physical body, the people you meet, our conversation right now is an extension of our consciousness, right? So I loved it because, wow, I thought more opportunity to take personal responsibility for things that I can take personal responsibility for. And I had a DMT experience, a 5-MAO DMT experience twice. And it was one of the most profound experiences of my life. And the best way I can describe it is I felt like everything but my consciousness was taken away. I had no physical body there, I didn't, there was no baggage. And that is, I didn't feel a difference in time. I didn't feel a difference between me and anybody else in the world, in the universe. It was so absolutely profound. And I've heard other people like Joe Rogan talk about it, and he thought it was a very scary experience because essentially you're dead. It's that kind of experience. It's like, where do you go when you die, sort of thing, when your pineal gland like dumps all that DMT. But to me, it was so profound. And it was a visceral experience of what I learned when I was in my program at USM, that everything that we see is an extension of our consciousness, and we do more when we work on ourselves rather than working on the external. Yeah.
It's so important. If you want to see the world around you change, start inside. Start with yourself.
That's right.
Because that's how you'll see the biggest shifts, the biggest changes in the world around you. I love that. Dave, it has been amazing talking to you.
Oh my God, is our time up? Oh my God, that went quick.
It's already been like an hour.
Oh my God. That was so much fun.
It's so fun.
And I felt like we have even more to talk about. Yeah.
I know we have so much. We'll definitely be having you on again.
I would love it.
If I always ask people before we head out, if there is something that you were to hang up right now and be done, and you were like, oh my gosh, I wish I had said this, what would that be for you?
Oh my goodness. Well, first off, there is no stigma or shame in saying, I need a little bit of help and support with my mental health right now, right? There's nothing wrong with it. And there's also nothing wrong to saying, well, I don't want to do the drug route. I would like to actually talk about potential childhood stuff, or, take personal responsibility for, I don't want to feel this way. So how can I think of it differently, and work with a practitioner like a psychologist or, some expert that is qualified, and have them help you and support you in that. There is, and especially just so with men's mental health, there is a stigma among men, as it's like a weakness to go to a therapist, right? A weakness to ask for help. Right. And that would be something I'd like to break for everybody, that it's okay to ask for help. It's okay. You don't want it to get worse. You don't want it to go down a rabbit hole, and that makes people feel more isolated. Right. It's like, reach out to people. And if your friends and family are either not capable, not equipped, or not kind enough to help, it's okay to ask for someone that's a professional at it.
Yeah, definitely. Especially moving forward from where we were a year, 2 years ago, moving forward, everyone right now, reach for help, whether you believe or don't believe that you are in a situation, because you could be helping somebody else by even having the conversation. You could be opening the door and say, I'm having kind of a moody month. I don't know what's going on. And you could open up the door for somebody else to say, oh my gosh, you know what? This is how I've been feeling lately. Or even just plugging in. There's so many outlets. There's so many places to find references and tools right now. Mental health, I think, has been put on the back burner for far too long in far too many ways. And it's essential. It's just like sleeping and breathing. It should be in the top 3 practices. If you want to live a happy, healthy life, your mental health is the foundation you need to build it on. Right?
100%. Thank you for saying that.
I love it. Well, it has been fantastic having you here. We're going to put all the links of where you can connect with Dave in the show notes, and we're going to let you know how you can reach out to him and ask him any questions that you might have, and connect with him in the different areas and platforms that he is associated with. And do you have a release date for your book yet? Or not yet?
No, not even close putting it together. Okay. Yeah.
All right.
I'm a ways away.
It's a project of love, and and we know it'll hit the books, but we'll get you here right before it does, before you can find it on the shelf. But know that it is a It is in the works and it will be out, and you'll be able to get your hands on it as soon as it is. So, Dave, thank you so much for being here, and we look forward to sharing another conversation with you in the future. Thank you, everyone, for tuning in, and we will see you again next week.
Thank you so much for listening to today's episode. And we want to hook you up because you're a loyal podcast listener. So head on over to www.rebeccapackard.com to get a special introductory price when you sign up for an emotion code session. Head on over to our website at www.rebeccapackard.com.